Welcome to the Dr. April Jasper Show, relevant conversations for business owners of today. All right, so this is really fun, you guys, because what we're doing, really two things, three things, maybe many things at once. This is my podcast, so the Dr. April Jasper Show. So we're recording, but what we're also doing is having a conversation together. So the intent for tonight, you can see I have two special guests, which they will introduce themselves in a moment. But our intent tonight is really to have a conversation, have fun. We're going to go through some questions that I'm going to ask the team here. And then at the end, we hope that you will take your workbook, add some things. So you guys have a lovely workbook in front of you that I think is beautiful. It gives you a place to take some notes. And then after we're finished with the podcast, we will have time for questions and you can ask real life questions to our team. All right, you guys good with that? Okay, so let me give you an idea of how this is going to go and really what we want to do. This is, again, not a presentation. It's not a clinical lecture. We're not going to talk about CE, although some of that stuff might come up, and that's okay. But what we really want to do is we want to talk about what makes our practices incredible. So we know that most patients, well, do we all know? I think we do. Most patients don't leave us because of the fact that we do a bad job as eye doctors or as veterinarians. They leave us really because of the experience. And I've been doing this now, you guys, for, David has to remind me, it's been 30, how many years? Lori, 32? So Lori's in the audience. It's been 31 years, which makes me feel ancient, definitely older than both of you. But I can tell you that throughout the years, it is absolutely true that the experience is what really creates loyal customers and patients. So what we want to do today is use the expertise of our panel here to kind of walk through stories. We want to talk about experiences that they've had. And what we really want to do is we want to take this opportunity to have real life moments that will help us to all do better in practice. All right, you guys ready? So let's start by having Dr. Alexis Gale tell us a little bit about herself and something special you're going to find out in a few minutes, but I'll get you started. Go ahead.
Okay. Hi, everybody. My name is Dr. Gale, and I am a small animal veterinarian in Tampa, which I know that already seems weird of like, why is she here? I thought the same thing when they invited me, but the more I thought about it, my job really parallels to what you guys do, especially when, and I've learned a lot about this from you guys, when you're talking to parents and you're trying to help children with eye disease like myopia. So my daily role is trying to convince pet parents that there's a medical situation going on. I've got to explain it to them in terms they understand. And I need to build rapport and trust really quickly to get them to understand that what we need to do needs to happen sooner rather than later. And they need to spend some money with me because my patients rarely have pet insurance. So all of that has to happen in a short amount of time. And that is every single appointment for me pretty much. So when I think about that and what you guys do, it really has a really cool parallel. So I'm honored to be invited here and happy to chat and share my experiences and see how this goes.
So our other moderator, or actually panelist, is Dr. Amanda Weiss, and she is close to me. So by that I mean we are in a very small area, West Palm Beach, very big area, right? Yes. And isn't your address Wellington? What is your address?
It's Wellington. West Palm Beach, depending on how you type it in. But yeah, I think there are a lot of people here from that area. A lot of friendly faces I see.
I love it.
Yeah.
So tell us more about yourself, Dr. Weiss.
So I have a private practice in Wellington. I did a family practice residency, and that really has been the practice that I have built in the community. We see children, adults. I do a lot of specialty contact lenses, and I do a lot of myopia management. That's something that we probably have been doing that for maybe 6 or 7 years now. I really enjoy it. Wellington is a family community, so once we have the children come into the practice, oftentimes parents, we were talking earlier about multifocal contacts, then parents come into the practice and want to be fitted with contacts after they see the great, very personal care that we give our patients. So that's a little bit about me.
You know, it's interesting though, like both of you said, that what builds our practice and really makes us create patients and customers that want to come back are really 5 pillars that we want to focus on. And so in our workbooks you guys have in front of you, we want to kind of focus on those 5 pillars and think about how we can build on those. And you both have done that, have done a great job in your offices. So as you look at those, I want to just give us a quick overview. The first pillar is clear confidence building communication. So as you heard already, we know that when people are confused, they hesitate. We can all probably think of a moment when a patient came in and whatever the message was we gave them was confusing to them. So they stopped and possibly left, never to return. So we know that's one pillar we want to focus on, and we're going to talk a little bit about that. The second one is keeping it simple. I won't say that the way some people say it, right? Some people use that KISS acronym. But we just want to keep it simple. And the reason that is I can tell you as a patient, if I walk in, and I love that we have eye doctors and we have veterinarians here. If I walk in, and you're right, doc, if I'm confused by the message you're giving me, then my likelihood of staying or saying yes is next to nil, right? Mm-hmm. And then the third one we want to talk about is what is that personalized human-centric touch? And is it different for both of your practices? Maybe. But it also could be very much the same. So we want to hit on that. And then consistency. So what some of you know is I've also written a book called Creating Your Business of Distinction. And what I love about these 5 pillars, they're very much the same as what I talk about. And consistency is one I think is huge. You go to any fast food restaurant, if you pick the one you love the most, the reason you love it is because every time you go, you can trust and count on the fact that the food is going to taste the same. And maybe even a non-fast food restaurant. Same idea applies. So we're going to talk about how that impacts our practice. And then finally, we're going to end with proactive, value-driven follow-up, which is the whole idea that the experience doesn't end when the patient leaves the chair. All right, you ready for this? You guys ready? Okay, let's do it. So I want to start with Dr. Gale. When you're explaining something serious, and I don't want to make us all sad, but there are a lot of serious conversations that happen in our office and yours. Mm-hmm. Something serious or uncertain to a pet owner, and I love how you called them pet parents. Is that what you said? I love that. What do you focus on first to build confidence rather than fear?
Yeah, great question. I want to go back a little bit to your intro because you mentioned when an owner or a parent, when a parent is confused, sometimes they don't even tell you.
Right.
They just leave with the information and they never come back, which you don't want. But I often am trying to explain medical conditions or blood work results or x-rays or something. And I have to adjust my language for sure. Like if I was talking to all of you guys, I can use medical terminology. And sometimes if I know they're in the medical profession or if they give me a hint, I can elevate my language to that. Otherwise, I need to really bring it down into terms they can understand and use words that really resonate with them. And I am visibly watching for those cues that they're getting it. They're on board with me. I have the ability to come around my exam table or flip it up out of the way. I'm hyper aware of my body language. I make sure I'm always greeting the pet, and making sure that they're the primary focus, which I imagine you guys do too with the kids. So all those things, I think, even in a serious conversation, help bring the emotional toll kind of down. So it's digestible and easy to kind of build that rapport and trust and get them to on board with my plan.
So, you know what I think is interesting about what you said, and Dr. Weiss, you're going to help us with this with myopia. When I think of times that David and I and our family have been in to see the veterinarian, we have 2 dogs, Basenjis, and we love them more than the world. But anyway, when we go in, even if I feel like I have some medical background, when I'm emotional, I don't really listen very well. And so I love that you do that. And I bet you anything, knowing from my experience, Dr. Weiss, that when people come in and then you start talking about myopia, it probably can go the same way. So how does this show up in myopia conversations, especially when parents are anxious or worse yet, does this happen to anybody out there, skeptical?
So I think that when parents bring their child in for an eye exam and they're just expecting to leave with a prescription for glasses, they're surprised when we start talking about this big thing called myopia that's a little bit more than what they first thought it was. So I think the most important thing to kind of bring the tension down and make them feel comfortable is to really define what we're talking about here. Myopia for a long time has been thought of as just a reason why someone needs glasses, but we now know that the reason behind it is due to an abnormal growth rate of the eye. So breaking that down, parents understand growth. They're used to talking about growth and percentiles with their pediatrician. So breaking it down into a problem with growth and talking about how we can overcome that with all of the new treatment options that are available and what the process looks like, making them understand a problem that they weren't expecting to find when they came to the eye doctor is something that can make them feel more comfortable. You mentioned talking to the pets, or at least paying attention to them whenever you're having conversations. I like to make sure that I'm talking to my pediatric patients when I'm having these conversations. We're talking about them. I don't want to turn my back to my 10-year-old patient in the chair just to have a conversation with mom. I think it's important to make the child feel comfortable in the room as well, because then mom's more comfortable if we're not talking about something big and bad and terrible and the child is excluded from the conversation. So.
That's good. Yeah, I found the same thing. It's so important to focus on them. I love that. So what about any other personal stories that you have, Dr. Weiss, about a patient coming in? Myopia management can honestly feel overwhelming. I think that what can happen, and I'm sure no different than in a veterinary office, is you start talking about this and they get scared, they get worried. It's overwhelming. How do you personally approach those conversations today?
I think it's important to break that down. I don't think we need to accomplish everything at that first visit. The patient came in for a routine eye exam. We're not going to talk about myopia and all of the different intricacies of the different treatment options that are available to the patient all in that 20 or 30-minute visit. That is overwhelming.
Right.
And the patient or the parent is going to feel like they didn't have time to get their questions answered. They're going to feel bombarded. So I think it's important to give them time to digest the information that you've just shared with them. Yeah. To let them leave with some information about what you've discussed, something in their hand, paperwork that talks about what myopia is. We send them an email after they leave the visit describing all of the things that we talked about in the exam room in a little bit more detail, and we also invite them to come back for a myopia management consult where we have plenty of time to discuss those things after they've had a chance to really digest what's just been, told to them about their child. I think have a process in place where you're not expecting to accomplish everything all in that one visit.
That's good. And remember, pillar 1 is all about clear, confidence-building communication. So Dr. Gale, how do you simplify, though, without oversimplifying? Is there a risk that could happen when stakes are high?
I don't know if I would call it a risk. Certainly you can get bogged down in some of the details. Like she said, you want to get your main points across. I love that you said you send up a follow-up email. I've started using, and I don't know if you can do this in human medicine, but like an AI record writing tool. And so it documents a lot of the things, and it will actually craft an email for me at the end.
I'm so jealous of that technology, by the way. Does anyone have that AI documenting tool? I want that. That would change my life.
Yes. I highly recommend. But it crafts an email, and then I make sure pet owners know that they can ask questions even between the next appointment. And I make sure that I'm accessible. So whether that's email or we have a hospital iPhone, they can iMessage me. I try not to make it to the detriment of my quality of life, but I just try and make sure that they know I'm here to answer questions, and sending that summary is huge. They really love that. You touched on a little bit something else about breaking down the information. I love it when owners visibly click that they understand something. So I will use, I'll draw pictures when I can. It's terrible, but I imagine the eyeball, you can draw pictures and things like that. If I take x-rays, I make sure and bring them in the room and show them on my computer. So there's a lot of value in not only breaking down the information, but seeing the tools that you're going to use and really kind of bringing them into your world so that there's some value and just trust that they get from seeing
good.
some of that stuff. So
I think those pictures that you draw make it relatable. When they can visualize what it is that you're talking about that describes the problem at hand, that can make it understandable. I talk about eyes being shaped like grapes. When you explain that to, everybody knows what a grape is look like, a long green grape. And when you explain that to the parent about, this is the problem we have here, we have an eyeball that's too long, and they can visualize that makes them understand the pathology of what's at hand here. And it's understandable and digestible at that point.
So as we talk more about communication, Dr. Gale, can you share a moment when you saw a client's understanding visibly click? What did you say or do that made that difference?
yeah, so I probably see it the most. I see a lot of second and third opinions, and I'm not sure why that is. I don't know if it's my Google reviews or they're just looking for more answers. And I think it's great. They're advocating for their pet. They're advocating for their children. They're trying to find what options are out there. The internet, everybody has answers right at their fingertips. So, and I'm kind of the new guy in town. My practice has been open 3 years. And so I still get, oh, you know what? I'm hearing good things about Dr. Gale, so I'm going to go get that second or third opinion. And so I like to break it down, like you said, into kind of digestible chunks. If you come in for a second opinion on your itchy dog, it can be overwhelming. It's itchy. You want some relief. Everybody wants to sleep in the house. You feel like you've tried everything. You're at one more vet who I think you had mentioned. They want my money. What shampoo am I going to buy now? But when I break it down into, okay, let's talk about what they might be allergic to. Let's talk about if there's a skin infection. Let's talk about itch management. Tell me everything you've already done. What do you know? And then I can get to what can we do next? And that I will often see them physically relax and okay, this one really is in it for my pet. They want us all to feel better in the household and the dog to feel better. And they're open to what haven't we done? What's different? What's new? And she's going to educate me a little bit on the underlying cause, because if you're just throwing at things to make it feel better and you're not getting to the root of the cause, then you're just back at the vet all the time. So people like when there's a goal, and they like that education. I think they like to feel empowered that there's something they can do, even when it's a little scary, when you bring up something they weren't expecting. Sometimes I'll mention culture or biopsy or these scary words, but at least
those are scary words.
But at least I've said we have options. I'm not saying I'm going to do one more thing that's already been done. I'm going to say, hey, let's talk about how we get to the bottom of it, and how we can move forward together. And I see those clients relax, and that's an awesome feeling.
Oh yeah,
I live for those moments.
Well, in a 3-year-old practice, guess what? You have a whole lot more of those moments on their way.
I hope so.
Keep it
it
up.
Yeah.
Just hearing you, we have itchy dog moments too. So I get it. All right, Dr. Weiss, let's get to you. Any specific moments like that, those similar click moments where you said, they got it. I did something right.
I can think of two things that are very demonstrative and very easy for parents to digest. And we already talked about one, allowing them to visualize the eyeball and what the actual pathology is by talking about the shape of the eye, but also talking about growth. Every parent knows that growth is supposed to be happening with their child. They don't know that there's a normal growth rate for the eye, or that being outside of that normal growth rate can be a problem, but they talk about those percentiles when they talk to their pediatrician. So they're used to those conversations. So introducing them to dialogue that sounds a lot like what they hear at the pediatrician is very easy to understand. The other thing that actually demonstrates physically what their child is seeing, and I'm sure a lot of docs in the crowd have done this, is just to take a loose lens out of your trial fit set and demonstrate to the parent what their child's vision looks like right now, and then what it could look like if it was worse, and what we're trying to prevent. You're not trying to scare them. You're just trying to show them, what does myopia look like to your child? What do they see when they open their eyes and they go into the classroom? So that allows them to kind of feel, in a sense, what their child is experiencing. And it also motivates them to want to learn more about what you can do to help their child.
So let's switch now to pillar 2, which was reducing cognitive load, or keeping it simple. So Let's start with you, Dr. Gale. What parts of the veterinary visit tend to overwhelm your clients, and how have you simplified the experience?
I mean, as you know, as pet owners, there are many pain points sometimes when it comes to a veterinary visit, right? One of the things I think about is if you bring your kids to the vet, right, and you're like, oh, they're out of school today, I got to cancel my appointment. One thing in my practice is just bring your kids. I have snacks and juice boxes and toys and cat ear headbands. Don't worry about that. I've got a diaper changing table. Bring your kids. That's totally fine. Sometimes it's, your dog is nervous. So, okay, well, we'll make sure the lobby's clear. Call me when you get to the parking lot. Whatever it is that is a pain point for you, if you verbalize it to me, even before the appointment, I can usually tailor a way to make it a little bit more comfortable. Cost, that's always a hurdle I'm having to overcome because I rarely have insurance that I deal with my patients. And so one thing that we do is we make sure everything's really upfront about the cost. Yeah. So, I do my entire exam. I go over what I would like to do to help me get to the bottom of what's going on, because sometimes he's lethargic. He's been under the table. My cat's been under the bed. I'm always solving the puzzle in my field, and my patient doesn't tell me what's wrong. So I'm constantly, well, your cat is 15 years old. I could use some blood work. I could use some x-rays, but there's a cost associated with that. Right. But what I do is I tell my associates as well is you stay in front of the client, you explain, your exam findings, what you would like to do today, and then you say, all right, well, I'm going to go put a treatment plan together. We'll come right back. Now, the other thing I haven't mentioned is my technician has been in there with me the entire time. So they've built that, rapport and trust already. So that same technician comes back in with that treatment plan. It keeps the doctors in the medical space and your recommendations, and it keeps you a little bit out of that financial discussion and decision. The technician who they've already met, so you're building that continuity of care, that consistency, which I think we're, kind of building on, kind of goes back in and goes over those costs, talks line by line, what's most important today. Yeah. The other thing we try and make important is if we don't do this today, that's okay. There are sometimes I have to say, I need all of this right now. Your pet is very sick, but there's sometimes things that can wait. Right. And when it does wait, that owner understands, okay, we talked about it today. If we don't do it today, that's okay. But if they come back in a few days or a week, that recommendation is still going to be the same. Or if they go to another veterinarian, whether it's in my practice or somewhere else, and they get that same recommendation, like, oh, okay, well, Dr. Gale recommended that the first time. When it's the first time they're hearing it and it didn't come from you, there's a little bit of trust that's lost. And I imagine you guys see that too, where you're getting that opinion because that mom just didn't feel like they got all the answers, and they come to you and they're like, finally somebody explained to me what could be done. Right. Because when you don't mention it, you're taking that decision away from them, and they didn't even get a chance to say no. And that's not fair to my pet owners. And I imagine the parents would feel the same way. I certainly would as a parent. Sure. So,
well, we want to know. So Dr. Weiss, where do parents get lost in that myopia process? Is it exams, options, pricing, follow-up? Tell me more.
I think the most overwhelming thing about the discussions I have are the options that we now have available. We're very fortunate now. We've got multiple different types of contact lenses that can be used for myopia management. We've got a lot of people using atropine therapy. We've got ortho-K. We've now got spectacle glasses in the United States. So with all of those options, if we threw all of that at a parent who's just now found out that their child has this problem that doesn't just need glasses, it's going to be overwhelming. So I try to, again, we talked earlier about just doing the routine exam and bringing them back. I do just graze over what the options are and that there is a treatment plan option for their child outside of just glasses. But I wait to really dive into all of those different options until they come back for their consultation. I also then don't dive in deeply into each of the options. By then I have data on the kiddo. I know the child, I know the parent, I know how involved mom and dad are. I know whether or not the child is fearful just based upon how they reacted when I did their exam with the microscope. Are they going to let me get close to them? Are they going to be open to the idea of contacts? What do their topographies look like? Do they have a cornea that's appropriate for orthokeratology, or are they better suited for soft contact lenses? if I personally, as the doctor, feel that the best myopia management protocol for this patient is going to be a pair of soft lenses based upon what I know about them, I'm not going to spend a lot of time diving into all of the different aspects of ortho-K or atropine therapy when that's not really the direction that I think is best for the patient. I think informed consent is important. It's important for them to know what their options are, but they also came to me for my opinion on what's best for their child. And it's overwhelming to dive into the science of every aspect of myopia management when you really could very much simplify that and make it less overwhelming for the parent.
That's good. I do believe, I agree with you. I want a doctor to tell me what I should do. I don't want you to give me a menu of choices. So
I hear that daily. What would you do if it was your own pet?
Right.
So that's really interesting to hear you say that.
And we still give them, I call it the menu. It's a sheet that has the itemized list of the different treatment options for myopia management so they can read it for themselves. But then I'm going to direct them on that journey about what my personal opinion is as their doctor and what would be best for their child. And then let them make the ultimate decision with also taking the child's opinion in mind as well. Going back to talking to the child, they have to buy into this as well. They have to be open to what you're proposing for their care.
That's good.
If they don't have an interest in sticking a contact in your eye, that contact is not going in the eye.
And why waste your time?
Yeah.
All right, Dr. DeGale, when you're talking with clients about long-term health, how do you help them understand the difference between preventative care and reactive care without scaring them? That's something that I think we all have in common as doctors, is the answer to that question.
Yeah, I probably see this most with wellness blood work. So when you come in for vaccines and it's not just parasite testing, it's you bring up the potential for, why don't we do some blood work today? And their pet is 3. And they're like, well, he seems fine. But that is how I will tell them, that's how I make sure the inside is as healthy as he looks on the outside. It also gives me something to compare back to over the years. And when you take it back to cost, some of the wellness blood work is like $80 more than you were already going to do for parasite testing. And they're like, oh, I can get full blood work for that little extra. And then, you win because you get more information on the pet, and then, they win because, it wasn't that much more.
Sure.
And then dentistry is another big one. You don't look at the back of your dog's teeth very often. So I'll either get them in when their teeth are awful and they can't stand the breath anymore.
Yeah.
But a 3-year-old Labrador where the teeth don't look that bad, that's sometimes a conversation, a hurdle I have to get over where I'm talking about dental care and things like that. So, but when I have a dachshund that hasn't had dental care and he's 7 years old and now he's under anesthesia for hours because it's 17 teeth that need to go, that was a way easier process when he was 3. And we do it every year. My own dog, I have a Cavalier King Charles Spaniel. They have notoriously bad teeth. I do his teeth every year because I don't want him under anesthesia for a long time. But that decision gets taken away from you when you're doing some of that reactive care instead of some of the preventive care, because now your decisions are much harder because things have gotten much worse and you can't take it back.
Sure.
So,
well, and I think too, isn't it worse as doctors to have a patient come back and say, why did you never tell me there was something I could have done? And to me, I feel like it moves us from where we're business owners that have lots of opportunities. Instead, it goes to obligation. And I would encourage you as a veterinarian to do everything you are currently doing, because as a pet owner, I'll tell you, I want to know. So thank you.
Yeah.
Don't be shy. All right, Dr. Weiss, let's go back to you. We have the same challenges. Talk to me about those challenges that come up for you in your practice.
So we're talking about trying to make it so parents understand the urgency of the situation without making them feel alarmed. So I can't remember how many years ago it was that I attended my first Vision by Design meeting in Chicago.
Okay.
It was eye-opening. I came home and said, what am I doing? The standard of care has shifted since I graduated, and I've got to be doing this. And I came home armed with information. And I remember one of my first weeks back in the office, I was sitting with a parent. I remember her face and her child, and I'm telling them, your child has myopia, and if we're not careful and we don't address this head on, we have to worry about things like glaucoma and retinal detachments and myopic macular degeneration and all of those things that we know that there's a greater risk for with a longer axial length when the child is older. It did not go well. There was crying. And so I have since softened my approach. There's also an element of parent guilt there. Like, we all have a budget. And parents, I guarantee you, when they come into your office for a routine eye exam, are not planning on you telling them that the care that their child needs is going to cost $2,500, $3,000, whatever that number is for myopia management. So many of them, when you tell them that that is the recommended care regimen for their child's myopia, that can be overwhelming, and if they think they can't afford that, they can feel some sort of guilt about not being able to provide that for their children with the budget that they have. So I think the way that I've modified the way that I approach this, because myopia it's serious, but it's not as scary as a retinal detachment. Down the road it could be. But so the old me, when I saw patients early on, the more conservative me would prescribe glasses and say, okay, well, your child is a myope, but let's just see how they progress and bring them back in 6 months and see where they're at. The new, more informed me now says, this is an 8-year-old. He's growing. He's not going to stop growing. Of course, his myopia is going to progress. And we need to have this conversation now. But why don't you take some time to think about the information that I've presented to you and that we've discussed? Nothing bad is going to happen if we take some time to review what your options are, come back, let's have a conversation about this. And I think that kind of brings the tension down in the room about, what the timeline is for addressing this. So.
That's good. I even said to somebody the other day, and I honestly wondered if I should have, and then I realized they're going to do it anyway. So I said to them, go look it up on AI. I mean, ask AI. I don't care. But these are the details you need to give it. And so that's the thing, they're going to. So what I've learned over the last year or so is at least give them all the details you want them to put in. Otherwise, they won't get a good answer. Okay, Dr. Gale, you ready? How do you present multiple care options? So now you're not just talking to me about blood work and, preventative tooth care, which, again, like I said, we definitely are not the best pet parents sometimes. But what about all of that? You need to get all of that information to us. How do you do it? How do you make it simple?
Yeah, so I think about, and I think I touched on it earlier, what would I do for my own pet? Like, that's kind of where I start, is sure, I would love blood work and x-rays and urinalysis when these pets are sick. Like, I would love everything, but that's really costly. So I try and frame it, what's most important and what would I do for my own pet. And I think there's a lot of value in that. And like I said, half the time they'll ask me, like, what would you do for your own pet? And I will set my staff up for the same thing as well. As there's everything on here, but if we need to start in a young lab that's not doing well, I'm probably going to start with x-rays because he probably ate a sock. But in a 17-year-old cat, I'm going to start with blood work because it's probably his kidneys. So I always tailor it a little bit of, where do I want them to land and what would I, do for my own pet.
That's good. What about our myopia patients? What do you think, Dr. Weiss?
So I go back to what I mentioned earlier about having my menu that we give to patients. We have a menu of options in our practice for the different types of treatment options for myopia management. On that menu lists, for instance, soft one-day contact lenses, for a treatment option for myopia management. Under that heading is what does the follow-up schedule look like? Maybe mom has 4 kids and they're all involved in activities, or she lives an hour away, or she's got a job that keeps her working during the hours that I'm open. That might not be the appropriate treatment plan for their family because it doesn't work for getting the patient to my office for all of the follow-up visits. So it's important to have everything out in front of them so that they can consider all of the things that affect their decision all at once, when we have that consultation and we talk through what the options are. So what is the follow-up schedule? What are the options for each of the different types of myopia management? What is the cost? One of the things that I got a really great tip on from one of our attendees here, Dr. Alleman is here, and I went to a boot camp that she offered a few years ago. And at that boot camp, she said, make it simple on your staff, make it simple on your patients, have everything be a global fee so that every time your patient comes into the office, they're not getting a new charge for a new service for the next feature of their care. Have that all spelled out so that they know what the expectation is for their visits and their cost before they start this journey of care for their child. And I think that's less overwhelming if you know what to expect in the year ahead.
That's good.
Yeah.
So, Dr. Gale, veterinary care, let's put it out there, is sometimes expensive and not fully covered by insurance. You already said that. Mm-hmm. So how do you deal with that? How do you communicate value so that your clients understand why it's worth it?
I touched on some of these already, but I make sure they have visual aids. So anytime I do blood work or x-rays, I bring it into the room, I print it out. We love to give all new clients tours of the hospital.
Oh, that's good.
So all new clients are an hour appointment, so you never feel rushed. I can read all of your previous records. You really bond with your veterinarian. And then we say, I know it's been a long day, but if you have some time, I'd love to give you a tour of the hospital, because most people have never seen the back of the veterinary hospital. And we get so many comments from clients of like, ooh, but there's value in seeing, maybe their pet doesn't need it today. Maybe it's a puppy appointment, but you can see my OR. Probably going to spay or neuter that pet one day. Maybe a dog's getting a dental when I give a tour and we talk about dental health. I have an ultrasound machine. I have digital x-ray. So in-house blood work. So that high-level tour, just a little circle around the office, makes them think like, one, there's no secrets. We're always tour ready. It's always clean and smells good. Two, if I'm just here for a puppy appointment today, but if in the future my pet is sick, wow, they really do it all. And we all try and, say hi. So we make sure, everybody is, when we can, greet the pet by name. All of our names are embroidered on our scrubs and our uniforms. And we try and swing them by the doctor's office so everybody can say hi. So it's really welcoming and engaging. And people love that.
I think we all need to go to Tampa for, with our pets.
It'll be a long drive with 2 Basenjis.
That's true.
And you're welcome.
Lori's dog's pretty big too. So, ours are little, but they're a problem sometimes. All right. So, Dr. Weiss, how might this change how you talk about myopia costs, care costs with parents? You talked a little bit about how you put it all into one global fee. Mm-hmm. Anything else you want to share about your fee conversations?
Well, so I think you have to take each patient individually. I know we have our fee structure set up, but I'll give you an example. So many of our patients have multiple children, and we have one family in particular that I can think of that has 3 myopic children and 2 myopic parents. So when you add up the cost of all of the care that family is going to have to come out of pocket for their materials and their visits, that can be overwhelming. Yeah. So I'm going to have the same conversation with mom for all 3 kids. We might, dive a little bit deeper into what type of myopia management might work better for one child than the other. But most of the time, they're all coming in for their routine eye exams together. We schedule one myopia management consult, and we schedule a little extra time, and we have a conversation about all 3 children about what the appropriate management plan is for each of those patients. So we're collecting one consultation fee. We do charge a fee for consultation, and that can be applied to the myopia management global fee. But that's one of the ways we work with parents. Other ways we can work with them, for contact lenses, for instance, there are rebate programs offered. We'll allow or permit patients to pay like a part of their fees up front and maybe pay the other half of their fee when they come back 6 months later. I think you do have to be careful with that, though. I have found that compliance is usually best when we pay for the entire program and all of our services up front at the beginning of the program, because then there's no reason reason why not to come back. I'm not going to owe any additional fees when I come back for those visits. I have a myopia patient coordinator in my practice who's wonderful. She came here this evening with me. She's like my right hand, so wonderful, Jalen. But one of the things that she does, and this is for all the patients in my practice, but specifically she does it for my myopia management patients, is those patients, their parents get an email at least the day before they come, giving them what the expectation is for the fees that will be owed when they come for that visit. If they're coming back for myopia management follow-up or for a consultation. So again, there are no surprises on what the fees are for that visit, and it's not overwhelming. And if it doesn't work for them at that point, they can reschedule the appointment if it's a larger amount due. So.
That's much better than an awkward conversation the day of the appointment,
at
right?
the front desk.
Yes, I love that. In front of the entire world.
Yeah.
So, Dr. Gale, you've talked about how I love the tour idea, by the way. That would really impress me as a pet owner. What about the environment itself? Anything else that you've done in this building? Anything in your hospital? I love that you call it the hospital.
I try and think about just my experiences in my everyday life. Like you mentioned your favorite fast food restaurant. I always think about Starbucks. Like my drink order at Starbucks is almost always exactly right. But when I go to Dunkin' or some of the other places, it's not, it's a little bit hit or miss depending on, the day and the person that makes it. So I think about that in my practice of, okay, well, what is that consistency? What does that feel, that experience? Because I imagine you guys have it too. There's a lot of choices of veterinarians in Tampa and everywhere. I imagine there's a lot of eye doctors that you can choose from, but you want them to choose you, and you want them to tell their friends and neighbors and family members about you too, and that's how you grow and you get good patient care. So the tour idea, we do that. We serve beer and wine, which what veterinarian does that?
My favorite idea that you had.
Yeah.
We shared that at another talk we did
You
together.
did?
Yeah, that was a great idea.
I can do it when I get my nails done. So I thought, well, why can't I do that at the vet? So we looked up the liquor laws, and as long as you don't have to be a client, because that implies a sale, then you can have beer and wine. So, it's just, it's not fancy, but even the ones that don't take us up on it, I get a win because I offered it.
Sure.
And it starts that conversation. We do thank you cards for every new client. So I mentioned it's a 1 hour appointment. It's a tour. We do a handwritten thank you for choosing us. Welcome to our practice. I should have brought one because we have a receptionist who's has been doing art lately with the names. So we had a cat in the other day. His name was Trash. And she was like, how can I make Trash pretty in the welcome card? And my husband, who's the practice manager, said, well, do Oscar the Grouch. So she did a little cartoon Oscar. It was so cute. I should have taken a picture of it. But you get real mail, and it's signed by everyone in the hospital. So we all hand sign it. But one, nobody ever gets real mail. And two, it's addressed to your pet. Just a little small thank you for coming to see us. And it's just one more little touch that we do that makes people feel welcome, and that experience. You're always looking for that experience. You might not remember everything I said. You might not remember your technician's name, but you remember that was the first time I went to the vet and it wasn't that bad. And actually, I really like that place and I want to come back. You remember that moment. So I think creating that is really special.
Well, and that's why it made it to one of our pillars, which is personalized, human-centric touches.
I'm jumping ahead.
No, you did great. That's exactly what I wanted you to say.
Yeah.
So we want to know, what are some of those ideas of things we can do that are personal and they're human-centric and they really just stand out to patients.
Yep.
So you're next, Dr. Weiss. Talk to me about your practice. And there's things about eye care. I won't jump in and tell everybody what they are, but there are things about eye care that can be intimidating to patients. So how have you taken some of those and made changes that make your office feel more welcoming?
More welcoming and less intimidating. Well, I think the biggest thing that patients, pediatric patients especially, are fearful of is it going to hurt? Jalen and I were talking on the car ride here today, and she said, you know what, one of the things that you say that immediately brings the temperature or warms the temperature up in the room, makes everybody feel comfortable, is you come in and you introduce yourself to the child and you say, we're going to have fun today. Nothing we're going to do here is going to hurt. And that immediately changes what the expectation is for this visit and this doctor, because all pediatric patients have been to a doctor before where it wasn't a fun visit. So that's one of the things, is just to talk about the expectations. I mean, kids are afraid of something touching their eye. They're afraid of drops that are going to go in their eye. They're afraid of putting a contact in their eye. So just kind of explaining what the expectations are for each step has been something that's been great, especially for our pediatric patients, even our adult patients. Things that make the visit feel more warm and welcoming. In our software that we have, I have the ability to take down notes. I can't remember everything. I wish I could. That would be my superpower if I could remember names and all the things that I hear during a day. But I do make notes when I meet patients and families on things that I'd like to remember to ask them about if I can't remember when they come back. One patient in particular that comes to mind is a child that really didn't want to be there. This was for a myopia management consult. Mom and dad said they had to come. It was a 10-year-old, 4-diopter myope, already on their way to being very myopic, and did not want to be there, and just curled into themselves. They have that look about them. And I started talking to her about, she was in her martial arts attire, and they were going to martial arts class. And I said, do you wear your glasses when you do your Taekwondo? And she said, yeah, or she said, no. And I said, well, how do you see? She goes, it's blurry. I said, wouldn't it be nice to see when you do your Taekwondo if you didn't have to wear your glasses? And that kind of changed, her attitude towards what we might be able to accomplish with this visit. So I think connecting with that child, not the parent, with the child, about what you can do to make their life better and easier and comfortable and clearer in this case, specific to that child and what they're interested in.
I'll admit I cheat too. So I'm going to pull the curtain back on your veterinarian, but we make notes as well. Because sometimes it's they had a baby and they tell you the baby's name, and when you know his name the next time they're in, they love that.
Yes.
Or they mention we're going on our honeymoon, and you can bring up that one little thing that they mentioned. We have a lot of glass, so when pet owners arrive, you can kind of see who's coming in the building. So we've trained our receptionists. You kind of look at the schedule, you see that the Shiba Inu is coming in. I mean, it's a very visible, obvious breed. You know that one was coming in at 2:00. And as soon as it comes in the door, you're like, hi, is this, I don't know your dog's name, but is this Fluffy? And they're like, yeah, yes, it is, and they love that. But you cheated, but nobody else needs to know that you cheated. So I love to hear that you make little notes too, because as a mom, I would love that you remembered. So I have 3 boys, but if you know which one does which thing, I think that would be super cool, and I would bond to you immediately. So
we've talked about getting to know our patients, but I also think what also is warm and welcoming and comforting is for our patients to get to know us. And what I mean by that is, so I mentioned that Jalen is here. She's my myopia management coordinator, and our patients love her. Jalen has so many paintings up on the wall in our office that children have made for her, and they love Jalen. Like, they come in and they get to know her. They know they can trust her. The parents know they can trust her. So creating that one person in your office, or 2 people, however many you need, however busy you are, that becomes a very trustworthy, reliable source for your patients and your parents, is also something that's very welcoming and comforting to families when they come to your practice.
So Dr. Gale, I'll tell you the story that for us, I found out there were notes that were made when my little Zoe, so she's the little one, Lori knows her, she's tiny as can be. So when I found out one of the notes they made in the computer was that Zoe needs a muzzle, I was like, oh my gosh, my little baby girl needs what? And that we needed to put it on her before she came in. That's how much of a stinker. She's sweeter than anything you'd ever imagine until she shows up in that clinic. But I bet you yours would not be like that, because it's warm and comforting and friendly. I'm sure Zoe would be much happier. But anyway, let's get back on track. Can you share a specific example, Dr. Gale, of a small personal touch that you've used to kind of put someone at ease, how that changed the results of what happened with them making a decision in your practice?
Personal touch. So I mentioned, kind of handwritten cards that always bonds them to me. Certainly sympathy cards when pets pass. I sent one of my favorite pet owners. She had a really old cat, and I probably saw her once a month. She recently passed, and we sent her flowers.
Oh, wow.
And then she sent me a thank you for the sympathy, which is
Aw.
interesting because it's such a big moment,
Yes.
and it's very memorable for the family. But that's probably when I get the thank you the most,
Wow.
is being a part of that moment. But sending her flowers was a really big deal. So then she sent me a thank you for the flowers. But it's because it was an end of an era. I mean, you really
Yeah.
bond with these clients because you see them
Oh.
so much. So,
Wow.
sometimes those little things. And you mentioned having like a person that people bond with. I have that a little bit, but I also kind of try and create the systems are in place, so it's always that same feel no matter who you encounter. So that it, even if I'm not there or they see an associate, when they really bond to Jalen and she's on vacation in New Zealand for 3 weeks, and where's Jalen? It can be a little bit of a cascade where it downfalls. So sometimes setting up those systems where it's a consistent experience and feeling can help
Right.
as well. So.
Yeah.
What about
I answer your
environmental?
question?
You did great.
Okay.
Yes. Personal or environmental changes you might make in your practice, Dr. Weiss, that would make a difference in and really helping your patients to be more likely and your parents to say yes to a myopia plan.
I think it just comes back to the things we were talking about, getting to know your patients. Another patient that I can recall, dad was really sick. Mom brought the patient into the office, and this was at a consultation appointment. We'd already done the routine eye exam. Child was very myopic, and I had known that dad had gone into the hospital because they were headed to the hospital after the routine exam. And when they came in, and before we even started talking anything about eyes or myopia, I remembered them and
Right.
and I cared about them, and I asked, how's dad doing? Did he come home yet? Is he
Oh,
feeling
man.
better? And he is better. But that is the most important thing of any topic that you're going to talk about in the exam room today, especially
Yeah.
to a child whose dad is ill or a wife who's carrying the load for the whole family right now. So I think just little things like that about getting to know them. Then I think she saw our practice, or maybe even me, as a person who saw her as a person who understands, that we're all just trying to get through this thing together.
That's good.
It's not just about collecting fees and contacts. It's about people.
Yep. I think that's the thing that hurts the worst when you get one or two of those bad reviews in your lifetime and they say that you're all about money. It definitely
It hurts, doesn't it?
and you want to just say, do you know me at all? But that's what we strive to do, is help them to know that yes, things aren't free, but this is why the value is there. All right, so let's move to consistency. So we talked a little bit about the other 3 pillars. We've got 2 more to go. I want to ask you a few questions before we end. In a busy practice, Dr. Weiss, patients interact with a lot of people. I know you have a coordinator. She sounds amazing. What about the
She is. You can't
other-
have her.
I know. I was just going to say, we live a lot close. What about the other folks in your practice, though? How do you keep consistency across every touch point?
That's a good question. So Dr. Gale made a very important point about how that can be a downfall to have just one person who does everything. Jalen is entitled to a vacation. So
Now she wants to go to New Zealand for 3 weeks.
she does.
You put it in her head.
I did.
So when I go to Vision by Design, for example, Jalen goes with me, okay? But when we come back from Vision by Design and we want to bring all of these exciting things we learned back to the office, I'm not the one who communicates that to the staff. Jalen is.
Nice.
So Jalen is revered by her peers, and they go to her when they have questions, and they learn from her because she has a lot of the same knowledge I do about what's new and what's great in eye care for our myopic patients. And so she helps them learn about how we handle, appointments and eyeglasses now that we've got spectacles for myopia management, and what the appointment schedule looks like for our myopia management program, so that nothing gets scheduled in a spot where we're not going to have enough time to spend the time we need with patients.
Right.
So she helps me to train my staff and the rest of our team about, what messaging we should be conveying to parents and to patients when they're in the office.
That's good.
Yeah.
How do you handle the same thing, Dr. DeGale? Staff training, retention. What is the client experience that shows them that you have a team that's all in this together and they are unified?
Yeah, I love it when I hear it so often. My clients will be like, you have the best staff. Like, how do you find these people? And I think it starts with hiring, hiring the right person and things like that, but also rewarding them, retaining them, a good culture, a good quality of life. Yep. And like you said, setting up these systems so that no matter who is interacting with the pet owner, it feels the same every time, or you
That's
hope
good.
it feels the same every time. And sometimes what feels really smooth internally feels really fragmented and disjointed to a pet owner. So sometimes I just think about, or I'll sit in my lobby and say, how does it look up here? Is it clean? Is everything flowing smoothly? I just try and think about what it would be like as a client to go through my practice and where can I do better. I mentioned saying our names a lot. Hi, I'm Dr. Gale. I have Amanda with me today. Just using those names so that they can, when they say, instead of saying, oh, the nurse that was just in here, they say, oh, Amanda told me, X, Y, and Z. So really kind of keeping that consistency. I mentioned that continuity of care. You always have the same technician throughout your entire appointment. So those little touches like that, I think, really help.
Those are very impactful. So Dr. Weiss, beyond the exam itself, how does your practice engage with patients and parents before and after those visits? And where do you see opportunities to strengthen that follow-up and continuity?
Oh, those great questions. And I will tell you that this has probably been the hardest part about establishing my practice as a myopia management practice, because I didn't know where to start. I mentioned earlier that I attended a wonderful boot camp that gave me a great foundation and some great ideas on what that care should look like. But that's hard when you're going from primary care to these special, unique visits that have a different length and a different messaging and a different behaviors and expectations set by your staff. So I'm really proud of what we've built with that. I mentioned earlier that patients, before they come to the office, receive an email from us informing them of what the expectation is for the cost of their visit. And that's pretty straightforward for a routine eye exam. I mean, most of them know they have insurance or they don't and what that's going to cost. It's a little bit more important and specific when it comes to coming back for a myopia management consult or their 6-month visit, where they may owe a balance for the contacts they haven't yet purchased or whatnot. So that email goes out. But probably one of the most important emails that goes out to our patients is the one that goes out right after a routine exam. So we do a routine exam. We find that a child is myopic for the first time and they're not enrolled in a myopia management program. We have a draft of a letter that Jalen or myself sends to that parent that just summarizes what the diagnosis is and what the recommended treatment options are and what the process is. Where do we go from here? When will I see you again? Should you come back in 6 months? Should you come back next week? What does that visit look like? What's the cost of that visit? It doesn't dive into the cost, but it introduces it as a program that's available, a treatment program that's available to them, and it gives them next steps and just kind of defines everything. Where that's also really helpful is when you have one parent in the exam room. Do you find that often? Like mom or dad comes, you give this big, great talk about what myopia is and what their options are, and then they say, can you repeat all that for my husband? and you've got patients waiting, and so we do that. But having that letter go home to them provides everything in writing that gives them kind of a synopsis of what was discussed and what the expectation is. So I want to hit on one other thing that happens after that down the road. So if a patient chooses to do contact lenses, we follow up with them a day or two after their insertion removal training when they've left the office with contacts. I feel like that's one of those very personal touches that parents really appreciate, because you threw a lot at the patient when they were there learning contacts for the first time, especially if mom or dad doesn't wear contact lenses. And now there's this whole world of solutions and rules and all of that. So giving them an opportunity to ask questions about these new contacts that their child just took home is great. They don't even have to call the office. We call them a day or two after that appointment to field questions and
Yep.
offer support. So.
Well, you did perfect there, because that was my next question, was about proactive, value-driven follow-up. So let's go to you, Dr. DeGale. What's one follow-up touch point that you feel that you've put in place that you know has really made a difference in your practice?
Yeah, you do way more follow-up than I do, but I probably should do more. I think dentists are really good at like forward booking that next appointment. But I think for us, it's probably that experience and that memorable things that we do. The handwritten cards.
That's good.
We also do like a thank you for the referral. We do like a little ice cream coupon for a local mom and pop ice cream shop. We send that in the mail if you mention that you send your friend or family or neighbor or whatever to us. So I think those little personal touches is what I would do. I'm not as great with the, if it's something big, like they declined whatever diagnostic it was, and I was really worried about that pet, I will personally do those, because I think hearing from the doctor in the next day or two of, hey, just checking in and answering those questions. But I don't have a great system in place, so I love to hear, sending out some of those emails. So that's a little tip I'm going to take back with me.
Exactly.
Sure. Yeah.
We're all learning from each other,
Yeah.
and I love that. So as we speed on to my very last thing, I want to give you some freedom in answering this. So I've been very specific with questions up until now. I'm going to be a little more general. So we've talked through these 5 pillars. We've given everybody kind of some ideas as to what maybe they could put in place. But if you look back, and the same question for both of you, where do you think practices most often miss opportunities to reconnect with parents after the visit? For you, Dr. Weiss, and then for Dr. DeGale, it would be, what do you do to make sure that your team takes advantage of every opportunity to connect and build trust and loyalty? So let's start with you, Amanda.
People think that they should go to the eye doctor maybe once a year, every couple of years. So when you tell them that you're recommending that they come back for a consultation or for a 6-month follow-up, that begs the question, why? What's the purpose of this? I think it's important to convey to parents and patients what we're going to be doing at that follow-up visit and why it's important to come back, even if you're not ready to embark upon a treatment plan like what we've discussed. So if a patient leaves our office after a routine eye exam and they choose not to schedule a consultation or a 6-month follow-up, we put them on a spreadsheet tracker that we have, and we follow up with them. We call them a couple weeks later after we sent our email, and we say, hey, we just want to confirm you got our email, see if you had any more questions after reading it. Dr. Weiss has recommended that you come back and we talk about these treatment options. If you're not ready to do that and you don't have any questions, may I recommend that we schedule a 6-month follow-up visit? And let me tell you what's important about that visit. So one of the things that Vision by Design has been hammering home the last few times I've gone is the importance of biometry. And so we purchased a biometer. We have that in our office, and biometers measure the length of the eye. We all know that. That's a number, and parents can wrap their head around that number. So one of the important things we're going to do at that 6-month visit is we're going to read or measure the length of the eye and track the progress of your child's growth. And then we're going to revisit this discussion about where we're at with that and the importance of intervening if we haven't done so already. So that visit's really important, and let me help you schedule that appointment. So following up on that so that you don't just see them a year later when they're 2 diopters more myopic is really important, and it shows that you care. Like
That's good.
that you're tracking them, the important things that you have the ability to track now that technology allows us to monitor.
Well, and it goes back to the whole purpose. Everything we started out talking about is we want to create an experience that shows our patients that we care, and we don't want them in any way ever to think it's all about money, because it isn't. We didn't get into this profession nor veterinary medicine for that purpose. Dr. DeGale.
Yeah, one of our big themes in our hospital is we like to make it easy. I like my life easy. I order from Amazon daily. I like when things just are smooth, and I'm not waiting in a drive-through, whatever it is. So I think about that at my practice too. So if you want to order from an online pharmacy, okay, just pick me as a veterinarian, I will say yes, because I know you're going to come to me for the big things, and I'm building that trust and that experience. And yeah, I want to be a place where we're doing things just a little bit different, just a little bit better, and I have that freedom because it is my own practice. So, yeah, I get to tailor it to what I would want as a pet owner, what I would want at my kid's eye doctor, at my kid's pediatrician. And so I've kind of been able to weave that into what I do every day. And it's really cool to see the result.
I love it. Well, as the oldest one in the group, I will tell you both, it is worth it every day that you continue to live this mission. I can tell you it makes all the difference in the world. It's the only reason after 30-something years I get up in the morning and go to work, because I love seeing what a difference we can make in our patients' lives.
Yeah.
So everything we've talked about, I think it helps to bring value to us as well, because that's what brings us joy. So I am very grateful for both of you being here. Thank you for giving us your time, sharing your expertise. It means a lot to me, and I know to all of our listeners.
Thank you very much.
Yeah, thank you for having
Great
us.
discussion. I learned a few things. We're serving wine this week.
There you go. And thank you also to Euclid. You know, they have been such a great sponsor of this moment for us, and they've got some amazing products. We know you guys will enjoy everything that you find there. Go to the website, check it out. When you think of myopia, I don't think there's anyone you should think of more than Euclid and Visionary Optics.